Back, we are in the midst of March Colorectal Cancer Awareness Month, and regardless of age, we should all be aware.
You hear it about other people so much, so when it's actually happening to you, it is a little bit it's surreal and shocking. It's sort of like an out-of-body experience at first, especially I have 4 young kids, and I have no other medical problems, and so it took me aback. I mean, I was taken aback.
Well, those are the words of 38-year-old Allie Jansen of Appleton. She told her story about being diagnosed with colorectal cancer to our Victoria Fraser. Now, that story aired at 4 o'clock today. You can go back and watch it at WBAY.com. Now, Allie's story tracks with the national trend. Younger adults are being diagnosed with colon cancer at a higher rate than older adults. And the American Cancer Society estimates there will be at least 150,000 cases overall in the country in 2025. An important cautionary tale during Colorectal Cancer Awareness Month. And we welcome in Amanda Robertson. She is a physician assistant with Amplify by Bellin's gastroenterology team. So we often hear, Amanda, that colon cancer is treatable, yet it's the second leading cause of cancer death. Those two don't seem to add up. Why do you think that is?
I think it's probably because patients are maybe not getting their screening colonoscopies done in a timely manner. Sometimes waiting until you have symptoms often means it's too late where that colon cancer has already progressed.
And by progress, this can be a pretty aggressive form of cancer if it's unchecked, right? I mean, it soon can metastasize elsewhere in the body?
Yes, because like I said, patients don't normally have symptoms of colon cancer because many times it starts off very small, such as a polyp, and that can kind of grow over time. And really, once you're having symptoms, changes in stools, even blood in the stool, weight loss, it can often already be metastasized in a later stage.
So as you talk about people waiting too long for their screenings, patients you talk to, are there still misconceptions about what this process is, what a colonoscopy is? Listen, it's not comfortable to go through it. I've done it twice. But the procedure itself is nothing. It's the lead up to it. But are there still misconceptions that kind of get people to pause and not do it?
Yeah, I think there's just kind of that stigma of, people, I think it's kind of weird or maybe gross to have that colonoscopy. But it is very important. Yeah, I'd say typically we hear that the prep is the worst part. But you got to get the colon clean somehow in order to get that direct visualization of the colon. And so the procedure itself is very simple, it's safe, it's quick. You get a nice nap and then wake up feeling fine. And you get that reassurance knowing that you had an entire look at the colon to make sure everything is clear, healthy. If there were any polyps, those are getting removed. So you're getting that screening and that prevention of colorectal cancer.
I can 100% verify the good nap. No question about it. The American Cancer Society, citing statistics from a 10-year study that they did that wrapped up in 2021, that while incidence among older adults, and by that, their benchmark is 50 years old. So incidence in older adults decreased about 1% each of those 10 years, but in younger adults under 50, it was doubling, a little over 2% each year. We have seen the recommended age drop from 50 to 45. Are you noticing younger patients, younger adults under 50, taking advantage of this?
Yeah, we definitely are getting a lot of patients that are coming in right at 45. There's even that gap of patients who are between 45 and 50 that are getting it now. But yeah, I have seen it with those statistics. We're seeing patients even sometimes younger than 45 that we're finding colorectal cancer. So it is very important to get that checked minimum at age 45. There are some patients who are at higher risk that might need to have it done sooner.
And part of this too, you and I were talking about before the interview, insurance has caught up to this now, right? So recommended age is one thing, allowed age is a different thing. And are most insurance companies now on board with this?
Yes, they are.
All right, so that started at 45. Let's take away the screenings. So before you get to the screening, what kind of preventative measures are best to take?
And my patients will attest to this. I'm a big believer in making sure a healthy diet is in place. So making sure you're getting a good amount of fiber. The gut likes fiber. It helps keep the bowels moving regular. Lots of fruits, vegetables, whole grains, beans, things like that. It's not to say that you can't have Red meats, those are good for you too, but just in moderation. And other big things are making sure you're limiting alcohol use and smoking cessation. Those can be make you at higher risk for colorectal cancer as well.
Can those measures help offset if you're a loser, for lack of a better phrase, in the genetic lottery? Let's say it's a hereditary thing in your family. How much can those measures actually help you?
I think they probably have some effect on that. But yeah, once there's that family history, there's just that increased risk, and anything you can do to help keep yourself as healthy as you can, I think, is important.
All right, and then also the screenings. If it's in your family history, do not sleep on your screenings. Overall, what would your message be to those folks who still haven't made up their mind to do their early screenings? What is the biggest danger in waiting? I think you already touched on it, but if you could elaborate a little bit on the danger in waiting and holding off on these screenings.
Yeah, I think the danger is just that you are at that risk of colorectal cancer. And, I hear patients say, well, it's not in my family. Nobody's ever had it, so I'm not worried about it. And just because it isn't in your family doesn't mean it couldn't happen to you. So I think it's important to get that screening test just to be safe. The statistics showing that this is one of the third most common diagnosed cancers and the second cause of cancer death in the United States. So those are big reasons to have that done.
All right, Amanda, thanks so much for the time. We really appreciate it.
All right, thank you so much.